Have you ever felt like you're a little more unsteady on your feet these days? Maybe you've noticed yourself tripping more often, or you're worried about the risk of falling as you get older. It's a common concern, and honestly, for a good reason. Losing your balance can be one of the biggest challenges and dangers that comes with aging. But why does this happen, and more importantly, what can you do about it? In this video, we're going to dive into 13 surprising reasons why your balance might be off after the age of 60. And believe me, you won't want to miss the 7th reason. It's the most dangerous one and something most people have never even thought about. By the end of this video, you'll have a clear understanding of what's causing these balance problems, and more importantly, you'll learn simple, effective strategies to regain stability, avoid falls, and get back to feeling confident in your movements. We're going to cover everything from muscle weakness to joint stiffness, vision changes, and more. Each one of these factors can play a significant role in balance, and we're going to break down each of them and give you practical, actionable steps to improve your balance starting today. So stick with us, because taking charge of your balance can truly transform how you live your life, and we're here to help you make that happen. Also, if you haven't already, make sure to subscribe and hit the notification bell so you don't miss any of our future videos. Your support really means a lot. And if you find this video useful, please give it a like and share it with others who could benefit. If you like the topic, leave a comment with the number 1, and if it's not quite what you were looking for, comment with a 0. Your feedback helps us create the best content for you. Alright, let's jump in, starting with the first reason your balance might be off: muscle weakness. Muscle weakness. Our bodies change as we age, and one of the most discouraging changes is muscle weakness. This natural process, called sarcopenia, starts as early as our 30s. At first, it seems minor, just a little bit less strength, but by the time you hit 50, it can start to accelerate in a way that's hard to ignore. And this isn't just about losing muscle mass, it's about losing the stability and confidence that comes with being physically strong. When your muscles, especially the core and leg muscles, start to weaken, it becomes harder to keep your balance. Imagine trying to keep steady on a wobbly surface with weakened legs. That's what happens as sarcopenia progresses. Suddenly, things like getting up from a chair, walking on uneven ground, or even catching yourself after a small trip become major challenges. And with every stumble, that fear of falling grows. But here's the thing, it doesn't have to be this way. The good news is that you can fight back against muscle loss. Engaging in regular strength training exercises, keeping up an active lifestyle, and eating a protein-rich diet can help you maintain muscle mass and even regain some of what you've lost. It's not about being a bodybuilder, it's about keeping enough strength to live independently and confidently. There's something incredibly empowering about knowing that you can take control of this aspect of aging. Joint stiffness. Next up is joint stiffness. This is something many people experience as they get older, and it's not just a little inconvenience, it can really get in the way of your independence. Have you ever tried to stand up quickly only to feel your joints resisting, like they're made of stone? That's what we're talking about here. As you age, the cartilage and connective tissues in your joints naturally wear down, and if you're not staying active, the stiffness can creep in faster than you might expect. Hips, knees, and ankles are some of the most crucial joints for balance, and when they become stiff, your range of motion is reduced. This makes it harder to recover from a small stumble or to walk briskly without feeling off balance. But let's look at the positive side. Joint stiffness isn't inevitable. Moving your body, even just a little bit, is the key to keeping joints flexible. Gentle exercises like stretching, yoga, or simply taking regular walks can do wonders to prevent that stiffness from taking hold. It's about making movement a part of your daily routine, and by doing so, preserving your freedom to move with ease. Inner ear problems. Now let's talk about something you might not think about often: your inner ear. The inner ear is home to the vestibular system, which plays a crucial role in keeping you balanced. It's like your body's internal GPS, constantly communicating with your brain about where your head is in space. When it works well, you don't even notice it's there. But as you age, the cells in the vestibular system can start to break down, making it harder to stay balanced. The result? dizziness, vertigo, and a general sense of unsteadiness. Imagine trying to stand up and feeling like the whole world is spinning. It's disorienting, and it can make even the simplest activities feel daunting. That's why it's so important to be proactive if you notice these symptoms. Balance-focused exercises and consulting a healthcare professional can help manage these issues and keep you safe. If you're still with me, leave a comment with the number 1 below to let me know you're finding this helpful. Reduced proprioception. Next is reduced proprioception, a fancy word for your body's ability to sense where it is in space. You don't really think about it, but proprioception is what lets you walk without looking down at your feet or reach for a cup of coffee without missing it. It's something you do every day without even realizing it, and it's critical for balance. As you age, though, the receptors in your muscles and joints that send signals to your brain about your body's position start to lose their edge. They don't send signals as quickly or as clearly, which means you might start tripping over small obstacles or feeling unsure on uneven ground. It's incredibly frustrating, and it can make you feel less confident about going out and being active. But here's the good news: you can help your proprioception stay sharp by staying physically active. Exercises like Tai Chi or yoga are particularly great for this because they challenge your balance and make you more aware of your body in space. It's all about keeping those signals firing to keep you steady on your feet. Vision changes. Our eyes are next on the list. Vision plays a huge role in keeping you balanced. It's how you gauge depth, spot obstacles, and stay oriented in space. But as we get older, our vision changes. Conditions like cataracts, glaucoma, and general age-related vision decline can make it harder to see clearly. Suddenly, that curb that was always easy to step off becomes a bit tricky, and walking at dusk or in dimly lit areas feels riskier. This can be scary, but again, it's not something you have to just accept. Regular eye exams, proper eyewear, and making sure your home is well lit can go a long way in helping you maintain your vision and, in turn, your balance. Don't underestimate the power of clear vision when it comes to feeling stable. Alright, we're almost halfway through. Stick with me because we've got more surprising reasons coming up, including one of the most dangerous that few people know about. If you found any of this helpful so far, give the video a like and let me know in the comments. It really helps out the channel and lets me keep bringing you more content like this. Vitamin B12 deficiency. Now, let's move on to a less obvious but incredibly important factor: vitamin B12 deficiency. Vitamin B12 plays a critical role in maintaining your nervous system, which is essential for balance. As we age, our bodies sometimes struggle to absorb this crucial nutrient effectively, and the result can be symptoms that easily get overlooked or chalked up to just getting older. Fatigue, numbness or tingling in the hands and feet, even problems with coordination, all of these can be signs that your body is running low on vitamin B12. The issue with a vitamin B12 deficiency is that it doesn't just affect your energy levels, it also impacts your ability to move confidently. This essential vitamin helps keep your nervous system healthy, and without enough of it, the nerve signals from your brain to your muscles can become less reliable. This can cause issues like muscle weakness or unsteadiness, both of which make falls more likely. It's heartbreaking to think that something as simple as a deficiency could strip away your independence or lead to a serious fall. Thankfully, this is one problem with a relatively simple solution. Eating B12-rich foods, like fish, meat, dairy, and eggs, or taking a supplement if your doctor recommends it, can make a big difference. If you're experiencing balance issues or symptoms like numbness or unusual fatigue, talk to your healthcare provider about checking your vitamin B12 levels. With a little bit of effort, you can potentially restore your strength and protect your balance. Medications. Next, let's talk about medications. As we get older, it's common to be prescribed various medications to manage chronic conditions. But what many people don't realize is that these medications, or even the combination of different ones, can negatively impact your balance. This is especially true for medications like blood pressure meds, antidepressants, and sleeping aids. They often have side effects like dizziness, drowsiness, or confusion, which can make it difficult to stay steady on your feet. This issue can be tricky because, of course, these medications are important for managing your health. but understanding their side effects and how they might be affecting your balance is key. It's worth having an open conversation with your doctor about any medications you're taking, especially if you've started noticing issues with balance or unsteadiness. There may be alternative options or adjustments that can help minimize these side effects without compromising your health. Medication management is a delicate balance, no pun intended. It's about making sure that the treatment you're getting for one issue doesn't end up creating a new problem that impacts your quality of life. Being proactive about discussing potential side effects can make all the difference in helping you stay independent and confident. Chronic health conditions. Chronic health conditions are another big factor when it comes to balance problems in older adults. Conditions like diabetes, Parkinson's disease, arthritis, and stroke can all interfere with your body's natural ability to maintain balance. Diabetes, for example, can lead to something called diabetic neuropathy, which damages the nerves in your feet and legs. This makes it harder to sense where your feet are, increasing the risk of tripping or falling. Parkinson's disease, on the other hand, affects your coordination and muscle control, leading to tremors and stiffness. Even something as common as arthritis can cause pain and stiffness in your joints, limiting your range of motion and making it harder to move fluidly. These conditions are not just physically challenging, they can also take an emotional toll, leading to anxiety about falling, which only compounds the problem. It's important to work closely with your healthcare team to manage these conditions effectively. Physical therapy, medications, and lifestyle changes can help you mitigate the impact these chronic conditions have on your balance. It's all about finding the right approach to manage symptoms and keep you moving safely. Dehydration. Next on the list is dehydration, something that might seem minor but can actually have a huge impact on your balance. As we age, our sense of thirst diminishes, meaning you might not feel thirsty even when your body really needs water. On top of that, certain medications, like diuretics, can make dehydration more likely. When you're dehydrated, your blood pressure can drop, which can lead to dizziness and an increased risk of falling. The thing about dehydration is that it can sneak up on you. You might just feel a little lightheaded, or maybe you notice that you're more tired than usual. But that lightheadedness can make it easy to lose your footing, especially if you're already dealing with other balance issues. Staying hydrated is one of the simplest things you can do to protect your health and your balance. Aim to drink water regularly throughout the day, even if you don't feel particularly thirsty. It's a good idea to set reminders to drink water, especially if you're someone who tends to forget. Keeping a water bottle with you and taking small sips throughout the day can make a big difference. Proper hydration supports your overall health, keeps your energy levels up, and helps you stay steady on your feet. Fear of falling. Now, let's address something that's a little less physical but just as impactful: the fear of falling itself. This fear can become a self-fulfilling prophecy. When you're constantly worried about falling, you start to move differently, more cautiously, more stiffly. And that stiffness can actually make you more likely to lose your balance. It's a vicious cycle. The more afraid you are, the more you alter your movements, and the less stable you become. It's completely understandable to be afraid of falling, especially if you've experienced a fall in the past. But that fear can lead you to avoid activities that keep you active and healthy, which only weakens your muscles and makes you more vulnerable. The key is to find ways to build your confidence back up. Balance exercises, working with a physical therapist, and even joining a group exercise class can help you regain strength and feel more in control of your movements. The goal is to help you move with confidence again. It's about taking small steps, both literally and figuratively, to build up your strength and reduce your fear. The more you trust your body, the better your balance will become. Reduced foot sensitivity. Another factor that plays a big role in balance issues is reduced foot sensitivity. Your feet are full of nerve endings that help you sense the ground beneath you and adjust your steps accordingly. But as you get older, these nerve endings can become less sensitive, which means you might not feel changes in the terrain as well as you used to. This reduced sensitivity can make it harder to walk on uneven surfaces or even to notice when you're about to step on something unstable. Conditions like diabetes can exacerbate this issue, leading to something called neuropathy, a condition that causes numbness in the feet. Without that crucial feedback from your feet, maintaining balance becomes much more difficult. You may find yourself tripping over small obstacles or feeling unsure when walking on gravel or grass. One way to combat this is to keep your feet in good condition. Regular foot care, proper footwear, and exercises that strengthen the muscles in your feet can help. It's also important to be mindful of your surroundings and to take extra care when walking on uneven ground. By keeping your feet healthy and strong, you can help maintain your connection to the ground and keep your balance. Postural changes. Finally, let's talk about postural changes. As we age, it's common to develop a more hunched posture, shoulders rounding forward, head jutting out, which can throw off your center of gravity. This shift in posture makes it harder to stay balanced because your weight isn't distributed evenly. You might find it harder to stand up straight or notice that you're more prone to tipping forward. These postural changes don't just happen overnight, they're the result of years of habits and muscle imbalances. But the good news is that it's never too late to start working on your posture. Simple exercises to strengthen your back and core muscles can help pull your shoulders back and realign your spine, which in turn helps you maintain better balance. Staying mindful of your posture throughout the day can also make a big difference. When you're sitting, try to sit up straight with your feet flat on the floor. When you're standing, think about pulling your shoulders back and keeping your head aligned with your spine. These small adjustments can help improve your balance and reduce your risk of falling. Chronic pain and its impact on balance. One factor that often gets overlooked when talking about balance issues in older adults is chronic pain. Chronic pain, whether from arthritis, back problems, or other health conditions, can significantly impact your ability to stay balanced. When you're in pain, you tend to move differently. You might shift your weight to avoid putting pressure on a sore joint or limit your range of motion to prevent a sharp twinge of pain. These compensations, while understandable, can throw off your body's natural alignment and increase your risk of falling. For example, if you have knee pain, you might avoid fully bending your knee when walking, which alters your gait. This unnatural movement pattern can lead to muscle imbalances, reduced flexibility, and an increased likelihood of stumbling. Chronic pain also tends to make people more cautious, and as we mentioned earlier, moving with hesitation or stiffness can make balance worse, not better. Addressing chronic pain can be a complex process, but it's an important step in improving your overall stability. Working with a physical therapist, incorporating gentle exercises, and finding ways to manage pain through medication or lifestyle changes can all help. Remember, it's not just about reducing pain, it's also about regaining confidence in your movements and feeling more stable in your day-to-day life. Footwear matters. The shoes you wear can make a huge difference in your balance, and as we get older, this becomes even more important. Wearing improper footwear, like shoes with high heels, poor arch support, or slick soles, can increase your risk of falling. You want to make sure that your shoes are comfortable, provide good support, and have non-slip soles to help you stay steady on your feet. Footwear with adequate arch support helps keep your feet in proper alignment, which in turn helps with your overall posture and balance. Shoes that are too loose or too tight can cause you to shuffle or trip, which only adds to the risk of falling. If you have foot conditions like bunions or plantar fasciitis, wearing the right type of footwear becomes even more essential, as these conditions can also affect your gait and stability. It's also worth noting that being barefoot or wearing socks on slippery surfaces, like tile or hardwood floors, can be dangerous, especially if you already have balance issues. Investing in a good pair of non-slip slippers for around the house can help reduce this risk. Don't underestimate the role of proper footwear in maintaining your balance. It's a simple change that can have a significant impact. Environmental hazards. Another major contributor to falls that people don't often consider is the environment around them. The way your home is set up can either support your balance or create hazards that increase the likelihood of a fall. Cluttered walkways, loose rugs, poor lighting, and lack of handrails are all common culprits that can make your home less safe. Take a look around your living space. Are there loose cords running across the floor? Is there a rug that tends to bunch up or slip? These are small things that might not seem like a big deal, but they can be very dangerous if you're struggling with balance. Making your home fall-proof can involve a few simple changes, like securing rugs with non-slip backing, installing grab bars in the bathroom, and making sure there's adequate lighting in hallways and staircases. It's also helpful to keep things you use regularly within easy reach. Climbing on stools or reaching for high shelves can be risky if your balance is already compromised. Making your home environment as safe and accessible as possible is a proactive step that can help you feel more secure and reduce the risk of a fall. Muscle tightness. We've talked about muscle weakness, but muscle tightness is another issue that can impact your balance as you age. When your muscles are tight, they can restrict your range of motion, making it harder to move freely and respond quickly to changes in your environment. Tight calves, for instance, can make it difficult to flex your ankles properly, which is crucial for maintaining balance when walking or standing. Tight muscles can also lead to compensatory movement patterns, where other muscles have to work harder to make up for the lack of flexibility. This can throw off your balance and make you more prone to stumbling. Stretching regularly is key to maintaining flexibility and keeping your muscles loose. Simple stretches for your calves, hamstrings, hips, and shoulders can go a long way in helping you stay balanced and mobile. Incorporating stretching into your daily routine doesn't have to be complicated. You could start your day with a few gentle stretches or take a few minutes before bed to stretch out any tight areas. Yoga can also be an excellent way to improve flexibility, and many poses are specifically designed to enhance balance as well. Cognitive challenges. Cognitive decline can also play a significant role in balance issues. As we age, our brains may not process information as quickly or as efficiently as they used to, which can affect our ability to react to changes in our environment. Balance isn't just about physical strength, it's also about the brain being able to process sensory input and make quick adjustments to keep you stable. For example, if you're walking and suddenly step on an uneven surface, your brain has to process that information and tell your muscles how to react to keep you from falling. If this process is slowed due to cognitive decline, you might not be able to react in time, increasing the risk of a fall. Cognitive challenges can also affect your ability to concentrate on multiple things at once, such as walking while talking or carrying an item. Keeping your brain active is just as important as keeping your body active when it comes to maintaining balance. Engaging in activities that challenge your mind, like puzzles, reading, or learning a new skill, can help keep your cognitive function sharp. Physical activity, especially exercises that require coordination or learning new movements, also has the added benefit of supporting brain health. Nutrition and balance. What you eat also plays a role in maintaining balance, though it's often overlooked. A balanced diet rich in essential nutrients helps support muscle function, bone health, and overall energy levels, all of which are crucial for staying steady on your feet. Calcium and vitamin D, for example, are essential for maintaining strong bones, which can help prevent fractures if you do fall. Protein is another key nutrient, as it helps maintain muscle mass. As we mentioned earlier, muscle weakness is a major factor in balance issues, so making sure you're getting enough protein is crucial. Omega-3 fatty acids, found in foods like fish and flaxseed, are known for their anti-inflammatory properties and can support joint health, making movement easier and less painful. Staying hydrated is also a part of good nutrition. Dehydration can lead to dizziness and lightheadedness, which can increase the risk of a fall. Making sure you're eating a well-balanced diet and drinking enough water each day is a foundational step in supporting your balance and overall well-being. Changes in reflexes. As we age, our reflexes tend to slow down, and this can have a direct impact on our ability to maintain balance. Reflexes are what allow you to react quickly to a slip or stumble. If you step on a slick spot, your body automatically adjusts to keep you upright. But if your reflexes have slowed down, you might not be able to react as quickly, and that's when a fall can happen. This slowing of reflexes is a natural part of aging, but there are ways to help keep them sharp. Engaging in activities that require quick changes of movement, like dancing or certain types of exercise classes, can help maintain your reflexes. Even something as simple as playing catch with a friend or grandchild can keep your reaction time in good shape. It's all about challenging your body to stay responsive and agile. Reminder to subscribe and engage. If you found any of these tips helpful so far, don't forget to like this video and share it with someone who could benefit. And if you haven't already, please subscribe to the channel and turn on notifications so you never miss out on our future content. Your support means the world to us, and it helps us keep creating valuable videos for you. Also, leave a comment below, let me know if you're experiencing any of these balance issues and which tip you're planning to try first. Your feedback really helps us make our content even better for you. Medication side effects. Another issue that often contributes to balance problems is the side effects of certain medications. We touched on this earlier, but it's important to emphasize that some medications can cause dizziness, drowsiness, or changes in blood pressure, all of which can impact your balance. Blood pressure medications, antidepressants, and sedatives are some of the most common culprits. If you've noticed an increase in dizziness or unsteadiness since starting a new medication, it's important to speak with your doctor. They may be able to adjust your dosage or switch you to a different medication that has fewer side effects. Never adjust your medication on your own, always consult a healthcare professional first. By staying on top of how your medications are affecting you, you can make sure you're doing everything you can to stay balanced and safe. Vision and hearing changes. Lastly, let's talk about hearing. We've already covered how changes in vision can impact your balance. But did you know that your ears play an important role in balance as well? Your inner ear is part of the vestibular system, which helps control balance. If you're experiencing hearing loss or inner ear issues, it can throw off your balance and make you more prone to falls. Regular hearing checks are just as important as eye exams, especially as you age. If you're having trouble hearing, it's worth getting it checked out, not just for the sake of your hearing but also for your overall balance and safety. Hearing aids or other treatments can make a big difference in improving both your quality of life and your stability. Peripheral neuropathy. Another common factor that contributes to balance problems in older adults is peripheral neuropathy. This condition occurs when the nerves in your extremities, like your hands and feet, become damaged, leading to symptoms like numbness, tingling, and even pain. When you can't feel your feet properly, it becomes much more difficult to walk steadily or react to changes in terrain, and this greatly increases your risk of falls. Peripheral neuropathy is often caused by conditions like diabetes, but it can also result from vitamin deficiencies, infections, or even side effects from certain medications. The numbness and loss of sensation that come with peripheral neuropathy mean that your body doesn't receive the necessary feedback to help you maintain balance. Imagine walking on uneven ground without being able to feel if you're losing your footing. That's essentially what it feels like for many people dealing with neuropathy. One of the best ways to manage this condition is by keeping underlying health issues, like diabetes, well controlled. If you have diabetes, it's crucial to keep your blood sugar levels within the recommended range, as elevated glucose can damage your nerves over time. Physical therapy can also help by focusing on exercises that improve strength and coordination, which can compensate for the lack of sensation in your feet. If you suspect you have symptoms of peripheral neuropathy, speak with your doctor. Early intervention can make a big difference in maintaining your independence. Age-related muscle mass loss. We've already touched on muscle weakness, but it's important to understand that age-related muscle mass loss, sarcopenia, is a significant factor that can directly affect your balance. Sarcopenia is not just a minor decrease in strength, it's a significant loss of muscle mass that accelerates after the age of 50 and can reduce your ability to perform everyday activities. This reduction in muscle mass leads to decreased mobility, coordination, and ultimately makes it more challenging to recover from trips or stumbles. For many people, the loss of muscle mass isn't something they think about until they start to notice that getting up from a chair or climbing a set of stairs becomes harder. This gradual decline can be incredibly frustrating, and it can feel like you're losing control of your own body. However, the good news is that you can fight back against sarcopenia by engaging in strength training exercises. Lifting weights, using resistance bands, or even doing bodyweight exercises like squats can help you maintain and even rebuild muscle mass. It's never too late to start, and any improvement in muscle strength can make a real difference in how steady you feel on your feet. Remember, building muscle isn't just about aesthetics, it's about maintaining your ability to move confidently and independently throughout your life. Loss of bone density. As we age, it's not just our muscles that weaken, our bones do too. Loss of bone density, often referred to as osteoporosis, is a condition that makes bones more fragile and more likely to break in the event of a fall. This can create a vicious cycle. Weakened bones make falls more dangerous, and the fear of breaking a bone can lead to reduced activity levels, which in turn causes muscles to weaken and balance to worsen. Osteoporosis often progresses silently until a fracture occurs, but there are steps you can take to maintain bone health. Calcium and vitamin D are essential nutrients for bone density, so making sure you get enough of both is crucial. Weight-bearing exercises, like walking, hiking, and strength training, also help to keep bones strong. These activities stimulate bone growth and help maintain bone mass. If you are concerned about bone density, it's a good idea to talk to your healthcare provider about getting a bone density test. This simple scan can help determine your risk of fractures and guide you in making the best decisions to protect your bone health. Lack of balance training. Balance, like strength or flexibility, is a skill that requires training. As we get older, we often stop doing the activities that naturally challenge our balance, like dancing, hiking, or playing sports. When we stop using these skills, our balance starts to deteriorate. The good news is that balance can be trained and improved at any age. There are many exercises that specifically target balance. Simple activities like standing on one leg, walking heel to toe, or using a balance board can help improve your stability. Tai Chi and yoga are also excellent options, as they focus on controlled movements and developing core strength, both of which are crucial for balance. Even just a few minutes of balance exercises each day can help you maintain or improve your stability. The key is consistency. Balance exercises don't have to be complicated or time-consuming, but practicing them regularly can significantly reduce your risk of falling and help you feel more confident in your movements. Slower gait speed. Another aspect that affects balance as we age is a decrease in gait speed. You might not think much about how quickly you walk, but gait speed is actually a good indicator of overall health and balance. As we get older, many people start to walk more slowly, often due to a combination of muscle weakness, joint pain, or fear of falling. However, walking too slowly can make it harder to maintain balance because it limits the momentum that helps keep you steady. A slower gait can also mean you're less prepared to react to changes in your environment, like needing to step quickly to avoid an obstacle. Practicing walking at a brisker pace, when it feels safe to do so, can help maintain a natural walking rhythm and improve your overall stability. Additionally, paying attention to your stride, making sure you're taking even, confident steps, can make a difference in how steady you feel. Vision and depth perception changes. We've already discussed how changes in vision can affect balance, but let's take a closer look at depth perception. Depth perception is your ability to judge the distance between objects, and it plays a big role in activities like walking up or down stairs, stepping off a curb, or even navigating around obstacles in your home. As we age, changes in vision, such as cataracts or macular degeneration, can affect depth perception, making it harder to judge distances accurately. This can lead to missteps or hesitations, both of which increase the risk of falling. Regular eye exams are crucial for catching changes in vision early and making sure you have the right corrective lenses if needed. If depth perception is becoming a challenge, making modifications around your home, like adding contrasting tape to the edges of steps or improving lighting, can make a big difference in helping you navigate safely. Inactivity and sedentary lifestyle. An inactive lifestyle is one of the biggest contributors to balance problems in older adults. When you're not moving regularly, your muscles weaken, your joints become stiffer, and your overall coordination declines. It's a cycle that can be hard to break. The less active you are, the more difficult it becomes to move confidently, which in turn makes you even less likely to stay active. Breaking out of this cycle starts with finding ways to incorporate movement into your daily routine. It doesn't have to be intense. Taking regular walks, gardening, or even dancing around the house can help keep you active. The key is to make movement a regular part of your day. Not only will this help maintain your strength and balance, but it will also boost your mood and energy levels, making it easier to stay active in the long term. Decreased coordination. Coordination is another skill that tends to decline with age, and it plays a big role in how well you can maintain your balance. Good coordination allows you to move smoothly and react quickly to changes in your environment. When coordination starts to decline, simple tasks like reaching for an object, turning around, or stepping over an obstacle can become more challenging, increasing the risk of losing your balance. The good news is that coordination can be improved with practice. Activities that require you to use multiple parts of your body at once, like playing catch, dancing, or even juggling, can help improve your coordination. Exercises that involve crossing the midline of your body, such as touching your left hand to your right knee, are also great for boosting coordination and maintaining neural connections in the brain that help with movement. Reminder to subscribe and engage. If you found any of these tips helpful so far, please give this video a thumbs up and share it with someone who might benefit from it. And if you haven't done so already, be sure to subscribe to our channel and click the notification bell so you never miss out on our future content. We're committed to bringing you valuable information to help you stay healthy and active as you age. Also, drop a comment below and let us know which of these tips you're planning to try first. We love hearing from you, and your feedback helps us create even better content. Medication interactions. Another often overlooked factor that can affect balance is medication interactions. Many older adults take multiple medications, and while each one may be necessary, the combination can sometimes lead to unintended side effects. Some medications, when taken together, can cause dizziness, drowsiness, or drops in blood pressure, all of which can make it harder to maintain your balance. It's important to keep an up-to-date list of all the medications you're taking and review it regularly with your healthcare provider. They can help identify any potential interactions and adjust dosages or switch medications if necessary. It's also important to follow dosage instructions carefully. Taking too much or too little of a medication can also lead to balance issues. Staying informed about your medications and how they might affect you is a key part of managing your health and staying safe. Medication side effects and management. One of the key contributors to balance problems that often goes unnoticed is the side effects of certain medications. Many older adults take multiple medications to manage various chronic conditions, and while these medications are necessary for overall health, they can come with side effects that significantly impact balance. Medications like blood pressure drugs, antidepressants, and sedatives often cause dizziness, drowsiness, or even changes in muscle coordination, all of which can make it more difficult to stay steady on your feet. The problem is particularly pronounced when taking multiple medications, also known as polypharmacy. The more medications you take, the greater the chance of experiencing drug interactions that can lead to side effects affecting your stability. For instance, combining a blood pressure medication with a sedative can result in excessive drowsiness or a sudden drop in blood pressure when standing up, increasing the risk of falls. Managing this issue starts with being proactive. Make sure to communicate with your healthcare provider about any side effects you're experiencing. If you feel dizzy or unsteady after starting a new medication, don't ignore it. Sometimes, simple adjustments, like changing the time of day you take a medication or switching to an alternative drug, can make all the difference. Your doctor or pharmacist can help you determine if your medication regimen is putting you at risk, and they may suggest a safer combination or lower dosages. Don't underestimate the importance of discussing your medications regularly to ensure your health and safety. Orthostatic hypotension. Another factor that can affect your balance is a condition called orthostatic hypotension, which is essentially a sudden drop in blood pressure when you move from sitting or lying down to standing up. This drop in blood pressure can cause dizziness or lightheadedness, which often leads to falls if you're not careful. Orthostatic hypotension becomes more common as we age, partly because our cardiovascular system becomes less responsive, and also due to certain medications that can exacerbate the issue. If you've ever stood up quickly and felt the world spin around you, you know how unsettling it can be. The problem with orthostatic hypotension is that it can strike suddenly and make you feel as though you're about to pass out. This is why it's crucial to take your time when getting up from a seated or lying position. Instead of jumping out of bed, try sitting up slowly, pausing for a moment, and then standing up carefully. Staying well hydrated can also help manage orthostatic hypotension, as dehydration can lower blood volume and contribute to drops in blood pressure. Wearing compression stockings may also be helpful, as they can improve circulation and reduce symptoms. If this is a persistent problem, it's worth discussing with your healthcare provider. There may be underlying causes or medication adjustments that can help stabilize your blood pressure. Sedentary habits and balance issues. Our next point focuses on the role of a sedentary lifestyle in contributing to balance problems. As we age, it can be tempting to slow down and spend more time sitting. While rest is certainly important, being too sedentary can lead to weakened muscles, stiffer joints, and reduced cardiovascular fitness, all of which can severely impact balance. When you spend most of your time sitting, your body starts to lose the strength and mobility necessary to maintain balance effectively. Being inactive can also lead to weight gain, which puts additional stress on your joints and makes moving around more difficult. The combination of weaker muscles, added weight, and decreased flexibility creates a perfect storm for balance problems. It becomes harder to move confidently, and everyday activities, like getting up from a chair, climbing stairs, or even walking, can become increasingly challenging. The good news is that it doesn't take much to break this cycle. Even a small increase in physical activity can help rebuild strength, improve joint mobility, and enhance cardiovascular health. You don't need to run marathons or lift heavy weights. Even activities like walking, swimming, or gentle yoga can help keep your body strong and flexible. The key is to find something you enjoy and make it a regular part of your day. Not only will this help your balance, but it will also improve your overall quality of life. Nerve degeneration. Another important factor that can impact balance is the degeneration of nerves, especially in the lower body. As we age, the nerves that help us feel the ground beneath our feet and coordinate our movements can become damaged or less effective. This nerve degeneration, which is common in conditions like peripheral neuropathy, reduces your ability to sense where your feet are in relation to the ground. As a result, you may feel less stable, especially when walking on uneven surfaces. When your nerves aren't functioning properly, it can feel like you're losing your connection to the ground. This sensation can be both disconcerting and dangerous, as it makes it harder to react to changes in terrain. Nerve degeneration is often linked to chronic conditions like diabetes, vitamin deficiencies, and even prolonged alcohol use. To help protect nerve health, it's important to manage any underlying conditions, such as keeping blood sugar levels under control if you have diabetes. Regular physical activity can also help stimulate nerve function and improve circulation to the extremities. Additionally, ensuring you get enough essential nutrients, like B vitamins, can support nerve health and help maintain your sense of balance. Environmental factors. Let's not forget about the environment you live in. Sometimes, balance problems aren't just about what's happening inside your body, they're also about what's happening around you. Environmental hazards like cluttered walkways, loose rugs, poor lighting, and slippery floors can all increase your risk of falling. Making small changes around your home can go a long way in keeping you safe and reducing your risk of losing your balance. Start by taking a walk through your home and identifying any potential tripping hazards. Are there loose cables running across the floor? Do you have area rugs that tend to slip or bunch up? Is your hallway dimly lit at night? These might seem like small things, but they can make a big difference when it comes to staying safe. Securing rugs with non-slip pads, adding night lights, and making sure your walkways are clear of clutter are all simple ways to create a safer environment. Installing grab bars in areas like the bathroom or near stairs can also provide extra support if you're feeling unsteady. Think of your home as a partner in helping you maintain your balance. By making it as safe as possible, you're taking an important step toward protecting yourself from falls. Vestibular disorders. The vestibular system, located in the inner ear, is responsible for helping you maintain your balance. It constantly sends signals to your brain about your head's position and movement. When this system is working well, you barely even notice it, but when it starts to malfunction, it can lead to dizziness, vertigo, and an unsettling sense of imbalance. Vestibular disorders become more common as we age and can be caused by conditions like benign paroxysmal positional vertigo, BPPV, labyrinthitis, or Meniere's disease. If you've ever experienced vertigo, you know how disorienting it can be. It feels as though the room is spinning, and even small movements can trigger intense dizziness. This can make it incredibly difficult to stay balanced and can lead to falls if you're not careful. The first step in managing vestibular disorders is to get a proper diagnosis from a healthcare professional. They may recommend specific exercises, such as the Epley maneuver, to help reposition the small crystals in your inner ear that can cause vertigo. Vestibular rehabilitation therapy is another option. This type of physical therapy focuses on exercises that help retrain your brain to compensate for vestibular dysfunction. By challenging your balance in a controlled setting, you can improve your stability and reduce symptoms of dizziness. Decreased sensory input. Our balance relies on a combination of three sensory inputs: vision, proprioception, your sense of body position, and the vestibular system. As we age, all three of these systems can start to decline. Vision changes, such as reduced depth perception or difficulty seeing in low light, can make it harder to navigate obstacles. Reduced proprioception, as we discussed earlier, means that your body may not be getting as much feedback about where it is in space. And vestibular issues can lead to dizziness and unsteadiness. When all three of these sensory systems are compromised, maintaining balance becomes significantly more challenging. One way to help compensate is by focusing on strengthening the systems that are still functioning well. For example, if your vision is declining, make sure to keep your home well lit and use contrasting colors to help identify steps or thresholds. Practicing balance exercises can help improve proprioception, and working with a healthcare provider on vestibular rehabilitation can help with inner ear issues. It's also important to take your time and avoid rushing. Moving slowly and deliberately can give your sensory systems more time to adjust and help you maintain your stability. Fatigue and its effect on balance. Fatigue is another factor that can significantly impact your balance. When you're tired, your muscles don't respond as well, your reflexes are slower, and your coordination is diminished. Fatigue can come from physical exertion, poor sleep, or even mental stress, and it can make you more prone to losing your balance and falling. Getting enough rest is crucial for maintaining your balance and overall health. If you're not sleeping well, it's important to identify why and take steps to improve your sleep quality. This might involve creating a bedtime routine, avoiding caffeine late in the day, or speaking with a healthcare provider about potential sleep disorders. Additionally, managing stress through relaxation techniques, such as meditation or deep breathing, can help reduce fatigue and improve your stability. Reminder to subscribe and engage. If you found these tips helpful, make sure to give this video a like and share it with someone you think might benefit from it. Don't forget to subscribe to our channel and click the notification bell so you're always in the loop when we release new content. We're here to help you stay informed and proactive about your health. Drop a comment below to let us know which of these tips resonated most with you, or if you have any personal strategies that have helped you maintain your balance. We'd love to hear from you. Post-surgery balance issues. Lastly, let's talk about post-surgery balance issues. After surgery, whether it's joint replacement, back surgery, or even something less invasive, your balance can be affected as your body heals. Pain, changes in movement patterns, and muscle weakness can all make it harder to stay steady. This is particularly true after surgeries involving the legs or spine, where movement is directly impacted. If you've recently had surgery, it's crucial to follow your rehabilitation plan closely. Physical therapy is often recommended to help rebuild strength and improve range of motion, both of which are key to maintaining good balance. It's also important to take things slow and not rush your recovery, listen to your body, and give yourself the time you need to heal properly. Over time, as your strength returns and your body adapts, your balance will improve as well. Lifestyle choices and their impact on balance. Our daily habits and choices play a huge role in our ability to maintain balance. These can either help or hinder our efforts. one of the most influential lifestyle factors is physical activity. As we age, it's common to become more sedentary, whether due to joint pain, lack of motivation, or simply the demands of everyday life. However, staying active is crucial for keeping our muscles, bones, and joints in good condition. Regular exercise strengthens muscles that support balance, improves flexibility, and boosts coordination. Activities like walking, swimming, or Tai Chi are excellent for seniors looking to maintain or improve their balance. Even low-impact exercises can make a world of difference, and the best part is that these activities can be done at your own pace. One of the major benefits of staying active is the improvement in posture. As we age, we tend to slouch or adopt poor postural habits due to weaker muscles or discomfort. Over time, this can lead to an imbalance in the body and increase the risk of falls. By engaging in posture-correcting exercises, we can improve the alignment of the spine and pelvis, which directly impacts our balance and overall mobility. Nutritional choices also affect our balance. A well-balanced diet that includes adequate amounts of calcium, vitamin D, and protein is essential for maintaining bone health. Osteoporosis and weakened bones are common among older adults, which can compromise balance and increase the risk of fractures from falls. To support your bones and muscles, make sure your diet includes dairy products, leafy greens, nuts, and seeds, along with foods rich in vitamin D like salmon and fortified cereals. Hydration is another factor that is often overlooked. Dehydration can lead to dizziness, confusion, and weakness, symptoms that directly affect our sense of balance. Make sure to drink plenty of water throughout the day, especially if you're engaging in physical activity. Dehydration affects not only your physical health but also your cognitive function, which can impact your ability to stay alert and oriented in space. The importance of environment. While lifestyle choices are important, your environment can have just as much impact on your balance. Many older adults face balance challenges because of their surroundings. For example, poorly lit areas, cluttered floors, and uneven surfaces can all present serious risks for falls. You can improve your environment by keeping pathways clear, using non-slip mats in the bathroom, and ensuring your home is well lit, particularly in hallways and stairways. In addition, grab bars in the bathroom and sturdy railings on staircases are essential safety features for seniors. These small adjustments can provide a lot of stability and reduce the likelihood of slipping or losing balance when moving around. If you haven't already, consider installing these simple tools to help you stay safe in your own home. Footwear is another critical aspect. While high heels or slippery shoes might seem stylish, they aren't the best choice for maintaining balance. Shoes with a wide, stable base and proper arch support are crucial for stability. Soft, cushioned soles that grip the floor will help you walk more confidently and avoid tripping. Moreover, don't forget about vision and hearing. If you've noticed a decline in your vision or hearing as you've aged, it's important to address these issues. Poor eyesight can lead to difficulty navigating uneven ground or avoiding obstacles, while hearing loss can impact your ability to hear cues that would otherwise help you balance, like footsteps or warnings. Regular eye exams and hearing checkups can ensure that any issues are addressed before they affect your balance. The psychological aspect of balance. Another fascinating element to consider when it comes to balance is the psychological component. As we age, fear of falling becomes more common. This fear can actually create a cycle of avoidance, where people stop engaging in certain activities or even walking as much because they are afraid of falling. Ironically, this lack of activity can weaken the muscles and systems responsible for balance, making falls more likely. Overcoming this fear often requires patience and a positive attitude. Taking small, gradual steps to regain confidence, like using a walker or cane initially and practicing balance exercises, can help break the cycle. Speaking to a healthcare provider or physical therapist can also help create a plan to improve balance safely, without pushing yourself too hard too quickly. It's important to remember that maintaining balance is not just about physical strength, it's about building mental resilience too. Practicing mindfulness or meditation can help reduce the stress and anxiety that often accompany the aging process, and staying mentally engaged in activities that challenge cognitive function can improve overall stability. Social support and encouragement. Finally, don't underestimate the role of social support. Having a network of family, friends, or support groups can make a world of difference when it comes to maintaining balance as you age. Not only can they encourage you to stay active and safe, but they can also provide the emotional boost you need to keep up with balance exercises or attend physical therapy sessions. Having someone by your side when you exercise or practice walking can offer the motivation you need to push through difficult days. Conclusion. To sum it up, achieving and maintaining good balance as we age requires a holistic approach. By staying active, choosing the right environment, addressing health concerns, and maintaining a positive attitude, we can significantly reduce the risk of falls and improve our quality of life. Keep in mind that balance is something that can be improved with time, effort, and the right support. If you've enjoyed this video and found it helpful, please be sure to like and comment below. Let us know what tips or advice you found most valuable. Don't forget to subscribe and hit the notification bell so you never miss out on new content designed to help you live your best life at every stage. Thanks for watching, and take care of yourselves out there.